video, I'll be sharing the 3 distinct phases which can be identified in dengue infection.
Febrile phase. This usually lasts 2 to 7 days. Patients present with sudden onset of high-grade fever accompanied by facial flushing, skin erythema, generalized body aches, myalgia, arthralgia, retroorbital eye pain, photophobia, and headache. Anorexia, nausea, and vomiting are common. Sore throat, an injected pharynx, and conjunctival injection may be seen in some patients. Patients may suffer an acute and progressive difficulty in carrying out normal functions. Difficult to differentiate dengue from non-dengue febrile illness during this phase. Hemorrhagic manifestations may be present. Liver may be enlarged and tender. Full blood count may indicate a progressive decrease in white cell count, which is one of the earliest signs and should alert the physician to a high probability of dengue. Patients should be monitored for warning signs and other clinical parameters for the development of the critical phase. Critical phase. During the transition from febrile to a febrile phase, patient enters a period of highest risk for developing the severe manifestations of plasma leak and hemorrhage. Usually starts around the time of effervescence between day 3 to 8 of the illness. The following warning signs usually precede the manifestations of shock: abdominal pain or tenderness, persistent vomiting, accumulation of clinical fluid, spontaneous mucosal bleeding, lethargy or restlessness, liver enlargement greater than 2 cm, increase in hematocrit with rapid decrease in platelet count. The period of clinically significant plasma leakage usually lasts between 24 to 48 hours. Patients with plasma leak should be monitored for early signs of circulatory collapse. Once a patient experiences frank shock, he or she will be categorized as having DSS. Convalescent phase. Patients who survives the 24 to 48-hour critical period will begin to reabsorb the fluids that leak from the intravascular space. The following may be observed during this period. Patient will report a sense of improved well-being, return of appetite, stabilizing vital signs, bradycardia, hematocrit levels returning to normal or low due to dilutional effects of the reabsorbed fluid, increased urine output, appearance of the characteristic rash, a confluent sometimes pruritic, erythematous or petechial rash with multiple small round islands of unaffected skin described as isles of white in the sea of red. WBC or white blood cell may increase soon after effervescence, but platelet count takes a longer time than WBCs to become normal. In dengue hemorrhagic fever or dengue shock syndrome, all 3 stages can be observed. In dengue fever, critical phase is normally bypassed.